Ladies and gentlemen, how are we? It is Sunday night. We're a little under a month away from the NFL. Starting to accumulate injuries already. If you haven't been here before, I'm Dr. Jesse Morse. I'm a sports medicine physician in Miami, and you're watching the YouTube channel for the Injury Experts. You probably known me as my previous company, the Fantasy Doctors, but we had to change things, a couple unforeseen situations, and I ended up closing that company and opening this one. I started a brand new channel, so if you wouldn't mind smashing that thumbs up and that subscribe, we will keep bringing you the same fantastic content, but some of it will be behind a paywall because, like you, I don't like to work for free. But we will still give you very high yield stuff, and if you want a competitive advantage compared to your league mates, that's what the paywall will be for. So I'm going to go back into the 28th, which is about a week ago, and there's a ton of injuries to talk about. I'm just kind of go in order, and then we'll kind of go from there. So the 49ers have been banged up with hamstring injuries. You had Isaac Guerrero. You had Jacob Cowing, both dealing with hamstring strains, and we saw their counterpart, Pearsall, actually finished with his hamstring strain and came back this week. Eric All Jr., the rookie tight end who's coming back from ACL reconstruction, returned to practice this past week. Rashad Bateman had a mild injury to the ribs, but nothing overly concerning. He's really struggled to really stay healthy for the past couple of years. The Bills' Ty Johnson likely has a hamstring strain. It wasn't clear exactly what it was. It looked like it was to his right side. That may set him back a couple weeks. We know that James Cook is the primary back there, but you'll see Frank Gore Jr. as well as Ray Davis competing. It'll be interesting to see how that plays out. Also for the Bills, Chase Claypool has been dealing with a toe injury, probably turf toe, but we're not sure. We saw Roman Wilson for the Pittsburgh Steelers, rookie, suffer an ankle injury. It didn't sound like it was overly concerning after the fact. And then we saw Chris Olave on July 30th suffer a hip injury, probably what we call a hip pointer, which is a bruise to the posterior hip. He left a little early. He came back the next day, so nothing overly concerning. Remember, he was dealing with a shoulder injury earlier in the offseason. We got confirmation that Aaron Rodgers is not expected to play in the preseason, which is not completely surprising. We haven't heard the same for Kirk Cousins. Both have looked pretty good so far. Obviously, Rodgers is a couple months ahead of Kirk Cousins, and Rodgers was to his front foot, his guiding foot, as opposed to Kirk Cousins, which was to his rear, his power foot. So that may have a role in throwing. We saw Kadarius Toney, who's no longer fantasy relevant, deal with a right lower leg injury on the last day of July, and then Donta Foreman had a scary injury. I believe it was on Friday or Thursday when he suffered a neck injury while he was returning a punt. Had to be life-flighted to a local hospital. Probably got x-rays and a CT scan, which ruled out any fractures, basically confirming that he had a neck sprain. I'm not sure if they did an MRI. Usually they will after. And he'll probably be able to return to the field in the next couple of weeks. Why is this relevant? Is because Nick Chubb is possibly going to miss week 1, may start on the PUP list. We haven't heard a whole lot yet. I'm going to give him a 50-50 chance to play week 1. And his primary two backups are Jerome Ford and Donta Foreman. So that's why Donta Foreman is still technically relevant here. We heard about a big injury on August 1st to Justin Herbert. He's dealing with a plantar fascia injury, which is basically to this area of his foot. This is what maintains the arch. He probably has chronically had plantar fasciitis, which is inflammation of that tendon where it attaches, really a ligament, attaches to the heel, quite painful. My guess is he partially tore it, which is even really more painful because now you still have a half of a ligament holding on the entire complex. Usually they shut him down for a boot in a couple weeks and then try to ramp him back up, but these don't particularly do very well, and a lot of times they will full thickness tear, which ends up working out better. I personally inject these with stem cells and they work out really well, but quite a painful injection. I'm not sure if that's the approach they'll take, but this is his power leg, this is his throwing leg, this is his mobility. You know, all of his offense is banged up. We'll talk about that in a second. So a little bit of cause for concern for Justin Herbert early here in preseason. Remember how Joe Burrow suffered that calf strain last year early, and it ended up kind of re-aggravating it early in the season, and that held him out, basically caused him to struggle with his deep ball and overall for the first month of the season. So this is not what we'd like to see. Herbert's supposed to incorporate this new offense with Harbaugh, and they're likely going to run the ball a ton. So this may be even furthermore why he's not going to throw the ball as much. So just some concerning stuff. Jermaine Burton, the stud rookie for the Bengals, tweaked his left ankle, not overly concerning. The rookie running back for the Detroit Lions, Sion Vaki, reportedly suffered a shoulder injury, but we didn't know any more than that. And then we had another big scare for a veteran wide receiver, but one that has potential, and DeAndre Hopkins. You could see him running routes initially, or at least running with some tape on his left knee. So that tells you he was already dealing with something. He likely re-aggravated it. My initial assumption was either an MCL sprain or a meniscal tear. It wasn't consistent with a PCL or a cartilage injury or an ACL or anything like that. They gave him a timeline of about 4-ish weeks or so. That would be consistent with a grade 2 MCL sprain, which is that ligament that runs north to south on the inside of the knee. You have to be a little careful with these because as getting tackled on the outside of the knee, their inside of the knee will collapse because that's where the MCL is, and it can tear the meniscus. It can also tear the ACL if you aren't very careful with this. If he is not expected to have surgery, which tells me it's not a bad meniscal tear, it is not a large piece of meniscus that is torn or flipped, because if it was, there's not a whole lot they can do besides surgery in a 4-week time frame to get him back and ready for the season. So that kind of leans me toward a grade 2 MCL, but he will be at high risk for probably about the first 6 weeks of the season for this injury for a repeat. So be careful here. I know he's a trooper, but he's a veteran, and it's tougher to heal up and play at an elite level when you start hitting your 30s. This will obviously help Calvin Ridley. We may see a little bump to Tyler Boyd, and we'll also see some more love for some of the running backs, both Tony Pollard as well as Tajay Spears, and maybe even Chig should get a little bit of love while he's struggling. Maybe Treylon Burks can show up this year and stay healthy himself, so we'll have to see how this plays out. Geno Smith reportedly dealing with knee and hip injuries. The imaging was reportedly basically negative, which means he doesn't have any labral tears. He doesn't have any significant cartilage injuries in his hip. He doesn't have any meniscal tears or any significant ligament injuries in his knee. Likely going to baby it and do a lot of PT and rehab this week, and probably return to the practice field later this week or early next week. But Sam Howell is waiting in the wings to capitalize this. There's some rumblings they're actually trying to have Geno Smith run more this year, which would be good for his fantasy value. But again, he's banged up, so we'll have to see how this plays out. Andy Dalton, the backup to Bryce Young, is dealing with a quad injury that is expected him to sideline him for most of the preseason. So we'll have to see if that has any real impact. Josh Jacobs dealing with another soft tissue injury. First time was a hamstring in OTAs. Now it is a groin strain, a little concerning. And we've seen A.J. Dillon look pretty good, and we've finally seen Marshawn Lloyd kind of get the ball rolling. He's a little setback from his hip injury. Kamani Vidal has been dealing with an injury. We don't have any details, and Jim Harbaugh's, or John, whoever one's in L.A., is going to be a pain about this. He's not good about discussing injuries. Demario Douglas suffered a hand injury. We don't know the details of it, but they did not let him practice despite him trying to get out there. Probably be back in the next couple of days, whether it's a sprain or an early fracture. I still really like him this year, and I think he's a sneaky late round pick if you're interested in a slot guy. As far as a couple big name guys, Ladd McConkey suffered either a knee or ankle injury. We couldn't exactly see what it was. We don't know what it is. It looked like it was to the right side. He does have a significant injury history for a bunch of stuff on that side, so we'll have to keep an eye on this. And with Herbert banged up already, I have some concerns about this offense in general. Tucker Kraft, he's finally medically cleared. He had a pec tear in reconstruction earlier this offseason, so he's back. Robert Tonyan, kind of filling in for TJ Hawkinson while he's coming back from his ACL. Robert Tonyan is dealing with back spasms. These have a tendency to recur and can affect player performance about 25 to 30% if he's dealing with them. So we'll have to see how that plays out, but he's not really going to be fantasy relevant. Quentin Johnston, also for the Chargers, dealing with something, but we don't have any details. Much to some people's surprise, Jonathan Brooks is expected to miss at least the first 3 weeks of the regular season, maybe longer, and he is going to miss all of the preseason. Remember, he's coming back from that ACL reconstruction, and he's really probably not going to be super ramped up, ready, and relevant until probably week 6 to 8, if not longer. So be careful with drafting him early. I think Chuba Hubbard is probably going to be the more relevant of the two. Maybe Miles Sanders looks half decent again. Rashid Shaheed is dealing with little hamstring tightness, but I don't know if there's anything more than that. Something definitely to monitor. Paris Campbell dealing with a groin strain that is allowing the other rookie, I can't think of his name right now, for the Eagles to get some reps. So he's looked really good, I guess. Another rookie, this time for the Carolina Panthers, Xavier Legette, dealing with a lower leg injury. It sounds like a mid-foot injury. It does not sound like it is a big deal, which basically means it's a mild Liz Frank or mid-foot sprain, which basically means he tweaked kind of the middle of this part of the foot. Give him a couple days to a week, and most of the time these guys do okay. But he has to be a little smart with this, because if not, this will linger for a while. That's what Najee Harris had a couple of years ago. Tyreek Hill confirmed earlier this week that he had a stem cell procedure in Antigua. That's likely the same facility that Kirk Cousins went to. No, they did not come to mind. But they also can do things in Antigua that they can't do here in America. That was per Bleacher Report. And finally, we saw a potential right knee injury for Puka Nacua today in practice. He was spotted with a bag of ice on his knee after. I tried to see the video. It wasn't super clear. Could be MCL, could be meniscus, could just be a mild sprain. We're going to keep an eye on this. Obviously, he's a top 10 wide receiver coming off of a monster season. Reports are Kupp looks pretty good. I still have my reservations. But in general, definitely something to monitor as we head into the first full week of August. We just had the cool new kickoff rules for the Hall of Fame game, and if anybody is going to the Fantasy Football Expo this upcoming week in Canton, I'll look forward to seeing you there. Thank you very much for tuning in. We will try to do these on Sundays. Next week's obviously going to be a little bit challenging with flying, but in general, we will try to get you out. If you're looking for fantasy content that is helpful for drafting, I did create a draft guide this year. You can check it out at theinjuryexperts.com. And we have a ton of different injury news and updates on our site, as well as all of the injury histories that you could possibly want there as well. Thank you for tuning in. Please subscribe, and if you like this type of content, come back and join us soon. Thank you very much. Take care.